Hi everyone, welcome to week 11. It is finals week and the end is here. You guys have made it. It's been a long 11 weeks, but you've done fantastic. So this week, we actually have 3 chapters to discuss. We have chapter 37, pages 847 to 850, chapter 43, and chapter 52. So chapter 37 is going to be dealing with and discussing how you assist with orthopedics. Chapter 43 is helping and assisting with medical emergencies and medical emergency preparedness. And chapter 52 is discussing physical therapy and rehabilitation. Now, you should have already learned about and discussed what you will learn in chapter 43 when you did first aid and CPR training. So for this video, I'm only going to talk about chapter 52 and 37. I'm going to start with chapter 52, which is talking about physical therapy and rehabilitation. So physical therapy is the therapeutic use of physical agents to diagnose, treat, manage, rehabilitate, and prevent diseases and debilitating illnesses. Rehabilitation, on the other hand, is the process of bringing the patient back as close as possible to their normal physical conditioning after an injury or disease has occurred. This will include certain therapies and therapeutic team members, such as physical therapists, physical therapy assistants, occupational therapists, occupational therapy assistants, recreation specialists, exercise psychologists, sports medicine therapists, massage therapists, and prosthetics and orthopedics individuals. Now, as a medical assistant, you must have a thorough understanding of the different therapeutic team members and the roles that they play during a rehabilitation. Before prescribing any sort of rehabilitation treatments, a physician really must assess the patient's ability to perform certain functions, such as their range of motion or the amount of movement in a particular joint, their gait or the way that the patient walks, and their posture or the lack, and what we're looking for is the lack of symmetry that may indicate a curvature in the spine that results in an uneven muscle development. Some conditions that require physical therapy are things such as disease, injury, birth defects, surgery, or amputations. And when we talk about physical therapy, there are several different methods that are available to help patients. Things such as massage, exercise therapy, range of motion therapy, applications of heat or cold, ultraviolet radiation, and ultrasound. So let's talk about each of these. So massage therapy is really where a therapist will use the kneading or applying pressure with their hands to the part of the patient's body to promote muscle relaxation, improve the blood flow, and reduce tension. Exercise therapy will result in the patient being active as an important part of maintaining their physical and mental well-being. Exercise programs are conducted to maintain or regain fitness through planned activities of the muscles and the joints. It also helps to rebuild some strength and muscle strength. Range of motion, like we talked about earlier, is the degree of movement that can be achieved on a specific joint without causing pain. Hopefully, by working on some physical therapy, it will actually increase the range of motion, and that's really what they're going to be watching for. Applying heat or cold is really used as a treatment condition resulting from some sort of trauma or infection. When you use heat or cold therapeutically, you want to only apply them for short periods of time, generally anywhere between 15 to 30 minutes at a time. So you're going to do essentially 30 minutes on, 30 minutes off, 30 minutes on, 30 minutes off. And maybe you do that for a total of 3 hours. And that will help to either relax the joints and the muscles, so that way physical therapy can begin. Ultraviolet radiation is where you're going to use the rays from natural sources, such as the sun, or artificial sources, such as sun lamps, to help the healing process. The most common use for these is babies who are born with jaundice. We use those artificial heat lamps and sun lamps to help kind of bring up that vitamin C. And the last one is ultrasound. This is where we use sound waves from high frequency, we use sound energy from high frequency sound waves to penetrate through the layers of tissue. And what this actually does is it allows the muscles and the tissues to regain their strength and to relax instead of being contracted. Alright, so we're going to switch gears now and we're going to talk about chapter 37. Again, that's only pages 847 to 850. So, chapter 37 will help explain the role a medical assistant will take during orthopedics. So just like in any other facility or any other specialty, when you are working in orthopedics, you'll be responsible for several duties. First and foremost, you'll be responsible for rooming patients, obtaining vital signs and measurements. That will not change in any aspect or any specialty that you work in. You'll be responsible for reviewing the patient's medical history and updating that, as well as completing any appropriate forms or documentation related to the orthopedic condition. This will change depending on the orthopedic that you do work with. Each of them will have their own specialty questions that they'll want asked. You'll also be responsible for scheduling diagnostic tests and procedures. But you'll also be responsible for not only working with the orthopedic, but physical therapists and occupational therapists alike. You may be responsible for providing patient education and support on treatments. You might be responsible for applying any therapeutic modalities, as well as applying heat or ice. So you could be applying casts or splints, as well as teaching the patients how to use crutches, canes, walkers, things of that nature. And the last thing that you might be responsible for is obtaining x-rays or other diagnostic images to help aid in the diagnosing and treatment of orthopedic diseases. Alright guys, so that's where I'm going to stop for this overview of chapters 37, 43, and 52. As always, I encourage you guys to read the chapters fully so that you will have a better understanding and an easier time doing your written assignment and your discussion post for this week. So for your discussion board this week, you are going to be talking about strains and sprains. In your own words, you are going to need to describe the difference between those two items. Along with that, you're going to talk about what are some injuries that could cause a sprain and what are some injuries that could cause a strain. You'll need to discuss what you think the treatment plan is for both of those. And your initial discussion post does need to be completed by Tuesday like normal, but your 2 responses will be due Friday by midnight as it is finals week. Your written assignment this week is again a 2-part assignment. You will need to submit both parts into a zip folder under one submission. Part 1, you'll need to read the attached case study, just like you did several weeks back. After you've read the case study article, you'll need to then answer the questions that accompany that case study. Part 2 of this assignment, you will be discussing triaging skills. You'll need to write a 1-page APA-style paper that discusses your role as a medical assistant during an emergency situation. There are a few more questions within this assignment that will help guide you in your explanation and your understanding of what triage really means. Now, again, because it is finals week, your written assignment is due Friday by midnight. And lastly, because it is finals week, you will be taking your finals. Remember, you will have a written final exam and a practical final exam. Both of those will take place in class when we meet on Tuesday. So please come prepared for both of those with all of the equipment that you will need. I hope you all have a wonderful finals week, and I will see you on Tuesday. Bye now.